Hi, I'm Robert Byrne from the Deutsches Herzzentrum in Munich. We're here at the ESC 2011 Congress in Paris, France, and I'm delighted to be joined by Dr Imazio from Turin in Italy, who's just presented some very interesting results from the CORP trial. Dr Imazio, welcome.
Thank you very much.
I know this is an area that you've been involved in conducting research for a considerable amount of time, and maybe you might give us a little bit of a background on the lead-in to the current investigation.
Yes. Recurrent pericarditis is the most common and troublesome complication of pericarditis, affecting about 1/3 up to 50% of patients with pericarditis, and no drug has been proven to be effective for the prevention of pericarditis so far, before the CORP trial. So we planned a randomized double-blind trial. It is the first multicenter double-blind randomized trials in this area to test the hypothesis that colchicine may be very efficacious and safe for the prevention of recurrent pericarditis.
Okay, and what was the dose of medication you studied, and was there loading involved?
Yes, we used weight-adjusted doses. This is a novelty considering the published literature. We used 1 milligram twice a day for the first 24 hours, and then 0.5 milligrams twice a day for 6 months, and other doses for patients of less than 70 kilograms.
Okay, and the primary endpoint then, I think you assessed at 18 months. What was the endpoint you looked at?
Yes, the primary endpoint was the recurrence rate at 18 months, and 18 months was chosen because we know from our previous publications that almost all the recurrences occur in this time course. So it is a sufficient long follow-up time to test the efficacy of a drug for pericarditis prevention.
Okay, good. So what did you find? What were the main findings of this current trial?
The main finding was that colchicine halved the recurrence rate at 18 months from about 50% in the placebo group to 25% in the colchicine group, and moreover the drug was also effective to halve the symptom persistent at 72 hours. So it is not only efficacious for the prevention but also for the treatment of the recurrent attack on top of anti-inflammatory therapy.
Okay, so a very clear treatment effect then in a randomized controlled trial. What are the implications of this research then for future treatment of this condition? This is a frustrating disease, we know, patients, and indeed frustrating also for physicians. And where do you think this trial brings us to?
Yes, we have clear evidence that colchicine is really efficacious and also safe. And we know from the CORP trial that colchicine is safe because the side effects rates and drug withdrawal rates are absolutely the same in the placebo and colchicine group. So we have evidence of efficacy and safety of the drug, and it should be considered as a first-line therapy for patients with recurrent pericarditis.
Okay, maybe before we finish, you might just tell us what were the co-treatments, or what were the other treatments that the patients received both in the placebo group and in the active treatment arm?
Okay, we have very balanced, well-balanced study groups. In about 90% of cases, we used aspirin or ibuprofen, using doses that are consistent with those recommended by the guidelines and reviews on the topic. And in less than 10% of cases, we used corticosteroid at low doses. And this is also an important point because we have learned that use of low doses of corticosteroid is quite important to shorten the disease length, and so we used the drug, and colchicine was used on top of the standard anti-inflammatory therapy for pericarditis.
Okay. So then a very clear message from the CORP trial, a clear reduction in events of recurrence associated with colchicine therapy, and these are very interesting findings. I believe we can read more about these online in a simultaneous publication?
Yes, the full article is published online today on the Annals of Internal Medicine.
Okay, thanks very much.
Thank you very much.